taking you live to the New South Wales Premier Gladys Berejiklian, who's doing a COVID update.
Ago to be advised that we have a case of community transmission in New South Wales. The gentleman is in his 50s, very active in the inner east. But can I firstly thank him for using his QR codes? So Dr. Chant, in giving her medical update, will be able to announce a number of venues where he frequented during the time that we believe at this stage that he was infectious. I want to stress that Health is undertaking genomic testing in relation to strains that exist in our quarantine system, but also the strains that exist in the other states, as he may have undertaken some travel during that time or been exposed to people in other states. So that genomic testing will give us some indication as to the strain and therefore some potential links. But at this stage, given it only occurred we were advised only in the last couple of hours, we don't have any information more than that. But can I thank the 13,500 people that came forward for testing yesterday? We need to make sure that everybody with the mildest of symptoms gets tested. I want to thank this gentleman who came forward and got tested. And obviously he and his direct contacts and close contacts are now either have been tested or in isolation or both. And it's really important for us to appreciate that whereas we've done very well to date, we are in a pandemic, and at any stage we could have a case of community transmission. Our job now is to get on top of it, to identify any other potential cases, to identify the source, and make sure that we get on top of this case. Can I please again stress that there are a number of venues which Minister Hazzard will reiterate available for testing, and in the past when we had a case in this part of New South Wales and this part of Sydney, the public were amazing in coming forward and getting tested. We really need that to happen, and we really need everybody to look up the health website for the venues. We have a number of venues already that he used his check-in in, and actually we know that he was present in the times, but we also know that there could be other venues added onto that list as people trace back their history, their contacts and where they've been. So this person did everything right, but it goes to show that we can't take a single thing for granted. It goes to show we have to maintain our social distancing. We have to make sure we have good hand hygiene. We need to get tested with the mildest of symptoms, and very importantly and significantly, we need to use the QR codes. Because this gentleman was very good at using the QR codes, we have good information on where he was and when. And the list is growing, obviously, but we'll be able to update the community on what is available so far. And can I also stress that this is another good reason why people who are asked to get the vaccine come forward and get vaccinated. The more of our population that's vaccinated, the less chance we have of having people acquire the disease and end up in hospital. And that's why it's really important, an important reminder that in addition to preventing the spread of the virus, that we also encourage as many people as possible who are eligible to get the vaccine to come forward and get it.